Honorable Dr. Rashid Aman, the Chief Administrative Secretary in the Ministry of Health, Kenya. His Excellency, the Honorable Professor Anyang' Nyong'o, Governor Kisumu County. The Secretary General of UNCTAD, Dr. Mukisa Kitui. The Chairman of Nation Media Group, Dr. Wilfred Kiboro. And the CEO of Nation Media Group, Stephen Gitagama. Delegates, moderators, speakers, good morning. There's a popular saying in this part of the world that when you come to Kisumu, you do as the people of Kisumu, right? And so because they speak some form of French here, I will teach you some this morning. So when I say Oyaure Uru, you say Oyaure Ahinya, okay? Are we together? It's basically good morning and morning to you, yeah? Except in French. So, Oyaure Uru? Oyaure Uru? Thank you very much. Karibuni sana. So, my name is Edmond Nyabola, news anchor and editor at Nation Media Group, and I will be your moderator and master of ceremony across the 2 days of this session. And welcome to the second KUSI Ideas Festival, an idea birthed in 2019 by the Nation Media Group to bring the continent together and to discuss ideas and issues affecting the continent for the betterment of its peoples and the future. I'd like to bring to your attention some housekeeping rules before we begin, and that we should strive to adhere strictly to all public health protocols that have been outlined by the Ministry of Health. We have a representative here today. By wearing our face masks at all times, keeping the requisite distance from each other, that is 1 and 1.5 meters, as has been designated, and also washing and sanitizing your hands whenever you need to. We have hand washing and sanitizing stations set all around this venue. So please, let's keep that in mind. The hashtag for this festival is KUSI Fest 2020. So let's start having that conversation within this venue. The Wi-Fi ID is KUSI Ideas Festival, and it's open, so you don't need a password to log in. So please log in and start speaking and making the necessary noise that we need for this conference. Delegates, participants, and everyone else, this year's theme, Towards a Post-COVID Africa, Recovering Together, couldn't have come at a better time. The continent finds itself in the middle of a global health pandemic with huge socioeconomic ramifications as well. And so across the 2 days, we will be discussing solutions and ideas that have been brought forward and how we can build on those to improve them to better our continent and our peoples. And so from the outset, I'd like to inform our speakers, our panelists, and indeed our moderators to be futuristic in our engagements. That is, what do we have and how can we build on that going forward? Because as they say, you look forward, never backwards, because you're never going backwards. And let me take, again, this opportunity then to introduce your moderators across the 2 days for various sessions. Let's please stand up. Joseph Warungu is a consulting editor at Nation Broadcasting Division, also a very experienced journalist, having worked with the BBC, and also a media trainer. He will be handling sessions on the new normal and what that portends. Smriti Vidyarthi is a senior news anchor and editor in charge of special assignments at Nation Broadcasting Division. She will be leading the high-level presentations. And we have Dan Mwangi, who is the editor in charge of innovation and digital at Nation Broadcasting Division, also a senior news anchor. He will be moderating sessions on arts, entertainment, and of course a bit of economic issues. And finally, Julius Amboko is the editor in charge of business and partnerships at Nation Broadcasting Division. He will be handling sessions on the economic positioning of the continent and, of course, the journey to recovery. Thank you so much. And so, without further ado, I'd like to invite the Honorable Achi Alai, who is the County Executive Committee member in charge of tourism, arts, culture, and sports, Kisumu County, for the welcome remarks. Karibu sana.
Distinguished guests, all protocols observed, it's my privilege and delight to invite you to the great county of Kisumu and indeed to Kenya. You're in a very cheerful environment here in Kisumu. It's a very vibrant people, and we always celebrate our guests and acknowledge them. Warwako, we welcome you. Kisumu offers a rich cultural vibe. One of the marvelous things about this community is that it enables us to welcome and celebrate people in a way we couldn't as individuals. And so, to this, the second edition of the KUSI Ideas Festival, following the successful inaugural event held in Kigali, Rwanda last year. Kisumu County is delighted to host this event in the midst of the challenges imposed by the COVID-19 pandemic. The pandemic has spared no city, has spared no country. But under the proactive leadership of our excellencies in Kenya, Rwanda, and across the continent, the region has shown great resilience in the face of tremendous health and economic challenges. And so too, the residents and citizens of those respective countries have acted and responded accordingly. And so Africa takes its future into its own hands, and COVID has shown us that we have no other choice. We're not waiting for outside think tanks to come and tell us how to do it, but instead, the agenda is being set by Africa, for Africans, and by the people who support the continent. We're delighted that KUSI, having inaugurated itself last year, had already thought of this story, allowing Africans to celebrate who they are and where they want to go. And so this conference will give us the opportunity to critique, to analyze, to strategize, and to celebrate together what we have done, who we are, and where we want to go. It's a fantastic thing every time Africans talk about their stories. So it gives me, again, great pleasure to welcome you to the great county of Kisumu and to Kenya. Come freely, go safely, and leave a little bit of happiness and sparkle in this great county. Thank you.
Thank you so much, Honorable Achi Alai. Let's be organized about how we appreciate our speakers, okay? Because we are decent people who have time to save as well, we'll just make it 3 claps, very strong ones, all right? So that we save time, okay? So up, 1, 2, 3. Thank you very much. Okay, now before we get into entertainment, the county government of Kisumu has prepared a short clip for us to tell us about this great county after that speech, of course. And we'll have that played right now as we prepare for the entertainment.
Welcome to the 3rd largest city in Kenya, Kisumu. Kisumu is a regional capital and a rapidly growing administrative, commercial, and industrial center for the Lake Victoria Basin. Situated on Lake Victoria, the world's 2nd largest freshwater lake, it developed due to its strategic location as an internal port and a railway terminus.
Kisumu was established as the head of the East African Railways, or Kenya Railways then, to open up transport along the lake to the other countries around the lake, Uganda, Tanzania, DRC, Rwanda, and so on.
Its rich endowments, such as the lake itself and the fertile agricultural land, gave rise to a thriving economy that provided employment opportunities in different sectors, such as the fisheries sectors, the agricultural sector, including large-scale production of molasses, cotton, rice, and sugar. The county also serves as the headquarters of the Lake Region Economic Bloc, LREB, that brings together 14 counties from Western Kenya as a means of pursuing stronger trade relations and agreements. As Africa strives to be a leading player in global politics and economy, the county government of Kisumu, through the stewardship of Governor Professor Peter Anyang' Nyong'o, is making strides too as it endeavors to grow into an economic hotspot in the region. Kisumu enjoys an abundance of natural wealth that offers tremendous investment opportunities. These include its strategic geographical location, arable land, a committed, abundant and inexpensive labor force, a sizable domestic and sub-regional market, warm, friendly people, and renowned tourist attractions such as Ndere Island, Kitmikai, Abindu Caves, and of course, Lake Victoria.
Every city must find a niche for itself in the national regional economy. So I thought that we should use the talents of our youth, the talents of our people in arts and culture, cultural expression, to give a niche, to fill that niche in our nation and our regional economy.
The lake has a shoreline that covers 95 kilometers, no doubt conducive for any investments in tourism and in the hospitality sector in general. The lake is a freshwater lake and is favorable for caged fish farming, as well as for purification for domestic and industrial use of water. Kisumu has been undergoing major infrastructural transformations. The rebuilding of Kisumu Port, a presidential project, is complete and already exciting the maritime activities on the lake.
As we continue to create an enabling environment for our enterprises to thrive, we are also enhancing connectivity in the country through ports, road and rail.
Kisumu ni kama city ya tatu hapa nchini kwetu hapa Kenya. Sasa na wafanyikazi na pia itaajiri wafanyikazi wengi. Na saizi hata ukikuja eneo ya bandarini, yani kazi inaendelea vizuri. Hata ukienda kule chini penye loko tunafanya kitambo kazi ya plumbing, imerekebishwa vizuri. Kwa hivyo tunapongeza sana hii miradi ambayo inaendelea.
You must remember that one of the commitments I gave the people of Kisumu was to restore Kisumu as a service port, a trading city, and a center of entertainment. These are the three unique qualities about Kisumu. We are very talented people here in music, in soccer, in stage performance, and you have seen it always.
Similarly, the Special Economic Zone project has been advanced with the World Bank in partnership with PricewaterhouseCoopers, and they have carried out a feasibility study and presented their report. These and many more, like the Koru Soin multi-purpose dam, are expected to commence soon, putting the country and the county on an investment takeoff mode, a journey that you are invited to participate in.
We in Kisumu are determined to stop walking with the chicken and being flying with the eagles.
Kisumu derives its name from Kisuma, to mean the place where we trade. Warwako Kisumu, we welcome you to Kisumu. And together, let us transact in ideas at this year's KUSI Festival, being held today, December the 8th, and tomorrow, December the 9th. And let's build our economies together.
Thank you very much. Warwako ukisumodala. Warwako ukisumodala, as the Honorable Achi said, thank you so much for that presentation. And in that spirit, of course, we do it the African way. And it's now time for entertainment by Michelle Omondi, a gospel artist from Kisumu. Take it away.
People, it is such an honor to be here in front of our father and our Mama County. Thank you. Thank you so much for supporting us. Tell your neighbor, restoration. He is not only restoring our finances, but he is restoring our joy, our peace, our health, and every other little thing. Anarudisha kila kitu. Abudiwa Bwana, tukuka Bwana, heshimika Bwana, tukuka milele. Wewe ni Mungu, hakuna kama wewe Bwana. Unayotenda hakuna mwingine awezaye tenda. unarudishia watu miaka yao waliopoteza. Unarudishia watu miaka yao iliyoliwa na nzige. Ulimrudishia Ayubu miaka yote aliyopoteza, mali yake, watoto wake wote ulirudisha tena maradufu. Bwana ulirudisha, nami najua nitarudishiwa, miaka yangu itarudishwa, iliyoliwa na nzige tunarudishiwa. Hey, miaka yote iliyoliwa na nzige narudisha, narudisha. Yote iliyopotezwa kwa nzige narudisha kwa jina la Yesu. Nzige wamekula amani ya wengi. Nzige wameharibu afya ya wengi mno. Angalia, imebakia mifupa mikavu. Tazama, imebaki mifupa mikavu. Lakini kuna tumaini. Bwana amerudisha, biashara zimerudishwa, afya imerudishwa. Waliopoteza maono yao mjipe moyo, Bwana amerudisha. Nasema yote iliyoliwa na nzige narudisha, narudisha. Yote tuliyopoteza kwa nzige narudisha kwa jina la Yesu. Amen.
Thank you so much, Michelle Omondi, making reference to the biblical plagues. Nzige are the locusts, the menacing ones. So we are facing two plagues as of this moment. We understand actually those locusts are coming back. But we'll deal with them. The next piece of entertainment is from Zeze Africa. As they set up, immediately after this, we'll have our first session on the African exemplars. And this is about how African resilience and smarts were actually developed and revealed during this pandemic. We already have two of our panelists here, and two of them will be joining us virtually. Zeze Africa, when you're ready.
Sophie
siyabonga Jesu, siyabonga onyamaleke, siyabonga Jesu, siyabonga ambanati, oh ambanati, oh ambanati, siyabonga, siyabonga Jesu, siyabonga onyamaleke, siyabonga Jesu, siyabonga ambanati, oh ambanati, oh ambanati, siyabonga otokoda, otokoda, otokoda. Thank you very much. Thank you very much. Wow, wonderful. Wapigie makofi. Let's please clap for them. You see, led by the governor. This is Kisumu, and we love life, and we dance to every single thing about human life. And so, Governor, they are leading us in that dance. Thank you so much, Zeze Africa and Michelle Omondi, for the wonderful entertainment. Ladies and gentlemen, it's now time for our first session on the African exemplars. And this is basically how African resilience and smarts were revealed by the pandemic. The continent proved doomsayers wrong yet again, and the pandemic did not exact the apocalyptic toll that they said it would. So the question is, how did Africa do it? Joining me for this session is the Honorable Dr. Rashid Aman from Kenya. He is the Chief Administrative Secretary in the Ministry of Health here. Karibu sana, Daktari. Also with us this morning, virtually, is Dr. Sabine Nsanzimana from Rwanda, who is the Director General of Rwanda Biomedical Center, which is the operational arm of the Ministry of Health in Rwanda. He's joining us virtually from Kigali. Dr. Kamarogo is the founder of the African Institute for Health Transformation. He is with us here this morning, also a former president of the Kenya Medical Association. Karibu sana, Daktari. And Dr. Shivon Biamukama from Rwanda as well is the managing director of Babil Rwanda, which is a digital health care provider, has played a very critical role during this period of the pandemic. Thank you so much and welcome, our panelists. So our first question to you, the Honorable Dr. Aman, is, so the first case of COVID-19 in the continent was reported on the 14th of February, and during that period, they told us that Africa would suffer a great impact. That has not been the case, and the rest of the world is now wondering how we did it. How did you do it as Kenya, Dr. Aman?
Thank you very much, Edmond. I think that is quite a loaded question, but I will tell you what we as a country have done to respond to this pandemic. From the moment that it struck us in March of this year. There are certain elements that I want to point out here, key elements, that I believe were important and very crucial in bringing us to the point where we are today in terms of containment of spread of the virus. I want to list at the top, first of all, a very committed and exemplary leadership that was taken by His Excellency, the President of this nation, who took charge right from the onset of this pandemic and set up a one government, one nation approach towards this response. Through that leadership, various structures were put in place, high-level structures, including the National Emergency Response Committee. These structures were replicated and cascaded down to the county levels as well. And this was very important for us to be able to coordinate this response to the point that we were able to function as one. The leadership was also inclusive in that it involved almost everyone. Everybody had a voice in this response. Several sectors of society were engaged, their opinions sought. The religious groups have been a part of the decision-making. Private sector has been roped into this response, and many other players as well. The decisions and measures that have been put in place have also been evidence-led. driven by science, in most cases. Of course, a time comes when one has to ponder and on the very difficult decision of balancing between saving lives and saving livelihoods, between health issues and economic and socio-economic impacts. And I think because of the leadership, we have been able to move through those very weighty decisions in our response. And we have also fostered partnerships in this response. I want to talk a little bit more about this partnership because I believe partnership is one of those things that has been very important, and I would say it is one of the exemplars. We were able to build upon our bilateral and multilateral partnerships with our development partners, including institutions such as the World Health Organization, the UN agencies, as well as regional and continental bodies. We also were able to develop partnerships, strong partnerships with the private sector. And I have to commend the private sector in our country because they did come out on their own and built up a very strong relationship with government. They were able to set up a private COVID fund that has supported this response. Philanthropy is another area that we were able to get good partners to partner with us, and through these philanthropies, we have been able to get a number of the resources that we required in the early stages of this response. So through these partnerships and support in many areas, in the very early periods when there was a scramble for many of the commodities that were required for the response, I have to appreciate the support that we got from these partners to put us on a firm footing as we moved forward in this response. Communication is another of the key elements in this response. When a country is hit with a pandemic such as this that creates panic, it is very important that there is a voice and a voice of reason out there to comfort the nation and to inform them of what's happening. We had developed a good communication strategy. We were visible, briefing the nation every day on the status of the pandemic. And I think this level of openness and transparency played a key role in bringing us to the point where we are. I would also want to mention adaptability. We are talking about resilience, adaptability, innovation, and entrepreneurship. Adaptability. Faced with the challenges, we had to adapt and adapt quickly. And we were able to do this through repurposing available resources. Together with our partners, we were able to repurpose funds that were earmarked for other activities to the COVID response. The World Bank, the Global Fund, the US government, funds that we already were holding with them were quickly repurposed for the response. We were able to repurpose the infrastructure, the laboratory infrastructure that we have. We have equipment, sophisticated equipment that were being used for other diagnostic purposes. We were quickly able to repurpose those equipment to meet our demand for testing. We were able to bring on board high throughput testing platforms that we have in some of our institutions, as well as build standalone testing facilities. To date, Kenya has tested, is closing in on 1 million tests. While this might not be what we had hoped we would be able to do given the challenges, I think it's a remarkable achievement. We were able to look at our facilities, repurpose them, scale up these facilities, create the necessary isolation units, the ICUs. When we began this response, we had only an 8-bed isolation facility at Kenyatta National Hospital. Today, through the efforts of both levels of government and our partners, we have about 7,000 isolation facilities across the country. When we started, we had about 56 ICU beds. Today, we have 320 ICU beds. We are not still there, but I think we have come a long way in being able to ramp up our health systems to be able to cope with this response. We were able to repurpose human resources, retrain them, hire new human resources for this response. In innovation, our industries stepped up to the occasion, faced the challenge, and repurposed their equipment and facilities so that we could manufacture locally PPEs, masks, and other commodities that we required, which were in short supply globally. The informal sector itself stepped up with innovation, workstations, sanitation stations, various gadgets, beds for hospitals. They stepped up and produced these things at a much lower cost, also injecting some energy into the economy. We repurposed impounded alcohol to produce sanitizers that were distributed throughout the country. Our core health responses were led by thematic groups under a task force, and they focused upon strengthening our public health emergency operation centers, strengthening our rapid response teams, building capacity in our human resources, ensuring that we had the right commodities, steady supply of health products and technologies, ramping up our testing through testing, tracing, and treatment approach, providing the necessary clinical management for those who required hospitalization, and putting some in quarantine and isolation. All of these efforts have resulted in what I would call a turbocharged strengthening of our health systems. Okay. And this is one, I think, of the positive things that I can say has come out of this, because we were on a journey to universal health coverage, which was built on building up our health systems and primary healthcare systems. COVID-19 just gave us a turbo injection that has brought us to a level where we might now be in a better position to achieve universal health coverage. I will not forget research. We also, our researchers, academicians, stood up to the challenge. Our scientists were able to feed in and produce models that informed decisions. Our scientists undertook studies such as serosurveillance of the COVID-19 disease in the country. And in fact, one of the first publications in the prestigious science journal is a Kenyan publication, and one of the first in sub-Saharan Africa on serosurveillance. We have been engaged in clinical trials, both of therapeutics and vaccines. The University of Oxford AstraZeneca vaccine is one of the vaccines that is a country we're involved in a phase of its trial. Our scientists, I think, have done an excellent job. They have even sequenced some of the isolates of the coronavirus that is circulating in this country. We have learned how to manage the disease. Yes. We have learned how to move on as we picked experiences. You remember that this is a disease that we didn't know about. We knew nothing about this particular disease. We had to learn as we moved on.
Exactly. And that's what you say about this disease and the virus being novel is very important. And Dr. Sabin, Rwanda was among the first African countries to go into lockdown really early, I think after the first less than 10 cases. And so movement and mobility, among other things, were disrupted. From a planning and strategy point of view in response, how did Rwanda do it to make sure that you contained the infections there?
Great. Thank you so much for having us, and it's a pleasure to be part of this conversation, this particular time where we think about ideas and how we can apply to this pandemic and maybe other crises and situations where we'll be facing in the near future. So I would like to start by saying that, as the title of this event clearly explains, we are very clear that what was probably not true, and what we see today is that even in situations where different countries are on the same kind of baseline, we end up by making a difference by applying homegrown solutions in different contexts. So COVID came in as a test for all of us, a test to our resilience, a test to see what we can invent and create and change, but also a test on how our communities, our scientists, and our leadership are connected to face something we never seen before in the last 100 years or more. So Africa, as you say, has been one of the continents that so far is managing this situation in a way that doesn't really take so many lives, and cases are quite well managed in many contexts in our continent. So Rwanda is one of the countries in Africa that, on the very early days, decided to try to advance the virus, because the choice was either you wait the virus controlling us or we control the virus. So the anticipation of this upcoming virus that we all saw coming from China, from Wuhan, has been instrumental in making key steps and key decisions, from communication, from setting up our diagnostics capacity, from contact tracing, from any other steps in epidemiology, up to the management of cases. As you know, we didn't have these large machines of ventilations for oxygen in many contexts. We're struggling to build this response as we fight the fire. So, but the fact that we had some time to prepare, I would say was very critical. And the fact that we were already dealing with similar pandemics already. So we already have many diseases and pandemics on our continent. So HIV being one, malaria being one, tuberculosis, there's so many diseases. And for our case as Rwanda, just last year we also had to make sure Ebola doesn't come into our country, because just 10 meters away we had cases on our neighboring country with Ebola virus disease. So we had to deploy epidemiologists and nurses and lab scientists to make sure we learn and also support each other as neighbors. But that was somehow a warm-up, a preparations for something we didn't know is coming as a virus from one corner of the world, and now has been a pandemic worldwide. Yes. So that for one part, Africa has been already dealing with this kind of similar diseases, and we've seen tremendous progress. If you take HIV as an example, I personally worked in the HIV program for more than 10 years, and I've seen how we came from HIV at the death sentence now as a disease you can live with and continue and attain your life expectancy, your dreams. So being ready for a pandemic like COVID-19 was not something new for us in that context. Yes. And of course, it requires some means and some further investments. But the second part, as I said, is the trust. I always call it a triangle between leadership, science, and the community. Yes. If those three dots are connected, you can achieve a lot of things in pandemics management. Okay. If the scientists can have the room to express what they think is right,
Yes.
Wearing masks, washing hands, social distance. And then the politicians will also say, what do you want us to do? And then the community will hear the politicians because there's the science backing up. That is also very important, and that's what we've been trying to emphasize and has worked so far here in Rwanda. And I've seen also in many other countries, in Africa particularly, people really abiding and following these public health measures. Respect, the discipline has been key. We never seen people saying, no, we don't want to do this, yet they know it's for their benefits. This is very, very important. So maybe to cut the story short, I would also mention that digital health or using technology to fight COVID-19 has been another key element for our context.
Exactly.
And for Africa in general, technology has been used in many ways, but when COVID came, it was like an accelerator of how COVID came in as a challenge, but also has helped our minds to think twice and to push forward what we think will happen in the next years. Applying these drones to deliver messages, to deliver medicine and samples, applying these robots to treat patients in treatment centers, but also at our airports, trying to limit these contacts, using this artificial intelligence in different ways in information sharing and also adapting and taking decisions has been very key for Rwanda, but also for Africa. If you look at how the statistics, I think the WHO Africa has shown how Africa has quickly implemented a lot of these technologies in just 8 months. Has been very instrumental. I think my sister will talk about that because we've worked on this e-health, how you can treat people from home without them coming to the health facilities.
Exactly.
And Siobhan will probably allude about this, but technology is key in the past, but this time of COVID has been an accelerator. It's not a luxury, it's not a secondary element, it's actually a necessity to start with. If we want to achieve faster, to advance the virus, as I say, you have two choices. You go ahead of the virus or you just follow the virus. So I'm happy that up to now, as a continent, we're managing. There are many other factors you can discuss on. People would say, no, it's because of A, B, C, D, but nothing happens for free. You need to do something to control a virus, otherwise it spreads.
Thank you.
We have comorbidities, we have people we have elders, we have all categories, but looking at how cases have been managed and mortality has been controlled in different settings in Africa, is something we really need to learn from and also apply it to other diseases, to other crises. And probably want to end this long response to your question by saying that COVID is going to show how important our health systems are in our lives, in our economies. So sometimes ministers of health or health institutions will go to finance and say, look, we need to invest in the health of people. And they would think twice comparing other sectors. But now we see that without a strong health system, all other sectors cannot function, cannot be protected. So this, for me, is a key lesson we've had from this time of COVID, and can be applied in our future investment, preparing for also future pandemics. Hopefully not, but there's no evidence that they will not happen. Thank you.
Thank you so much, Dr. Sabin. You mentioned two very critical points, and that's the use of technology, one, and two, the fact that we might be living with this for quite some time. And I'd like to talk to Dr. Siobhan Byamukama, also live from Rwanda, from Kigali, joining us virtually. Your organization, Babil Rwanda, has come up with technology that you use to link patients to various hospitals without them necessarily going there physically. And that has been very helpful during this period of restricted movement. Has the uptake sort of increased, and how are you developing this to also accommodate the times we are in?
So thank you very much for inviting us for this important conversation. So I really appreciate that. So a bit of, how we do what we do. Maybe I'll start from explaining how we do what we do. So we're a digital health company and we provide medical consultation over the phone. To do a complete consultation, you need laboratory tests and prescription. We have partnered with the government of Rwanda so that once you've done your digital consultation, we give you a prescription code. You can go to a laboratory or to a pharmacy and get your prescription. We have partnered with about 418 health centers in 2018, and the number has gone up to about 480 of 507 health centers that we're in. How this has been important, this has been very critical because you need government partnerships to be able to achieve what it is that you achieve. So how we supported the pandemic, a lot of work has been centralized around what the government is doing, and Saben has been leading on those efforts. For us, even with a pandemic, normal conditions kept going. Malaria didn't take a backseat, and all these other conditions didn't take a backseat as the pandemic was happening. And our contribution was to decongest the health centers. So if you can treat people from home, then they don't have to go to the health facilities to congest people there. And even when you go to do a laboratory test, you just go draw your blood, go home, and you don't have to wait for the results. We will call you and give you the results. During the lockdown, we saw actually an increase in the number of people who are consulting us from home grow up by about 155%. So the other things that we did beyond that was we do about 3,000 consultations every single day. We changed our protocols so that every single person that calls us, we give them, information about COVID-19, how to prevent it, and what symptoms to look out for, and also telling them, to keep following, the Ministry of Health guidelines and so on. If people were consulting us and we thought that there were suspicious cases, we'll send them to the RBC, and then that would be centralized, taken care of there. The other thing is that we have an IVR system so that every person who calls our call center also has to listen to the protocols and guidelines. So for us, it was a lot of information sharing. Recently, we partnered with RBC, headed by Dr. Seben. And what we're doing is when people are quarantining in from home, they need to be comfortable that there's a doctor taking care of them.
Yes.
So we're dealing with people who are asymptomatic and mildly symptomatic, and we follow them up on a daily basis to make sure that they are getting the necessary treatment or just the comfort and so on, and also not spreading the virus. So that is part of what it is that we're doing. How has this even been possible? I think three things are very critical. One is an enabling environment. When we went to 418 health centers, it was literally going to each health center, each village, and saying, do you get a signal? Go to the nearest health center. Is there a laptop? Do they have internet? And then we connected to have portals, just making sure that so the infrastructure has to be there as a fast starter. The next thing was partnership, because one of the things that digital health does, and pandemic has shown this, is that accessibility is very critical and affordability is very critical. So, and we do that through the mobile phones. Africa have mobile phones. And so what we're putting is a digital service on their mobile phone to provide care. But we know that a complete circle of care is not just a consultation. You also need to go to a laboratory. You probably need to go and you need to get medication and so on. We couldn't have done this on our own. And so we partnered with the government so that now in 480 health centers throughout the 30 districts in the health center, you can then go and get the care that you need. That's the previous speaker from Kenya alluded to universal health care. And I think that's also very critical. Mm-hmm. Accessibility is very critical. So now once you provide the care and make it accessible and affordable for everyone, and the people are not able to get the laboratory tests because however cheap you make it, people will still have issues around, because the higher cost is around, getting your laboratory tests and so on. 85% of the Rwandan population has universal health care. And so they're able to go and use, get their prescriptions and a laboratory paid for using their health insurance, which is the universal health care system, which is, I think that all those things add together to be able to make it work. And in March of this year, we signed a 10-year contract with the government of Rwanda to continue doing what we do, doing digital consultations and for this to continue. So I think that important things that we noticed, partnerships with governments and universal healthcare are all very critical to make digital really work. And obviously, as Ben has said, it's not just us. There are people who, were delivering, drones are delivering medications and so on, to the country. And also use of robots, so that we reduce we limit the contacts and so on.
Okay. Thank you so much, Dr. Siobhan. So you mentioned something very critical, and this is the universal health coverage. We're coming to that. But before that, let's speak to Dr. Rogo, who is the founder of the Africa Health Institute for Health Transformation, also a former president of the Kenya Medical Association. Dr. Aman mentioned something very important, and this is the wave of innovations that we have been seeing across the continent in manufacturing PPEs, sanitizers, and all those other things, defenses that we needed to fight this virus. And there's a question of quality and standardization, Dr. Rogo. As a former KMA head, how do we streamline and mainstream some of these innovations to make sure that they meet the requisite standards, to be able to use them to control various other diseases and not just COVID?
Thank you very much, Edmund. I'm from Kisumu, so I'm particularly happy that this thing is happening here. And as you know, Kisumians are people who are dynamic, brilliant, and outspoken. So if you bring a conference of ideas, you will leave this place with a gunia of ideas. The first thing is that it would be very bad of us in this conference to discuss COVID in past tense. We are not past COVID yet. And if we do not recognize that, then we'll be failing from the beginning. In fact, the pandemic, from the context of Africa, we are still largely in a pre-pandemic stage. So let's not pat ourselves on the back too early, because this thing is just arriving. We have a virus that started in China, went to Europe and America, and Australia, and we are the last continent to get it. It takes time before this virus hits you and before you experience its brutality. I believe that the brutality is still ahead of us, and for goodness sake, let us not pat ourselves on the back. With regard to the question that you've asked me, the issues of quality are linked not only to the exercise or event of manufacturing, but to a culture that has to be linked to what my Rwandese colleague has called being able to link the dots. And there are three areas of linking of the dots that I want to link onto your questions on quality. Number one, Africa, within the context of COVID, must be asked the question that to what extent were we able to link the dots between one, vision, two, resolve, and three, implementation. Does Africa have one vision? I think that CDC Africa in Addis Ababa has tried its best to make it work together. But we've seen major cracks in vision and resolve to fight this thing. Just East Africa on its own, just 6 countries that we are there, we know that we are not working and reading from the same page with regard to COVID. We have issues around what to do with trans-border passages and the people who are working along there. We have countries that have declared that COVID doesn't exist. So when you start looking at exemplars, we have to ask ourselves, what does it mean in terms of Africa and what we do? The second area of the dots has been the question of being able to link human resource, fiduciary responsibility, and service delivery. Have we done it? I think that COVID has revealed the worst in our inability to handle our health army, the human resource. And the number of African countries where doctors and nurses are not working today does not augur well for fighting an epidemic of the size of this. So pat yourself on the back, but know that if the army is not there, it doesn't matter how many guns and bullets you are going to manufacture. Somebody has to go with them out there and be in the trenches and fight it.
Okay.
Are we linking those dots?
All right.
And fiduciary I bring on board because this is probably our weakest link. Do we buy what we need? And do we get it in the place where we need it in time? And do we buy it for the right cost or something else? And the shame of Africa in COVID will be written in history as the problems that we've had with procurement of PPEs and virtually everything. And it doesn't have to happen that way. But it is happening and it is huge.
Okay.
This must be linked to one thing, that our procurement has not been focused on the stage of the epidemic. People must realize that when you're dealing with an epidemic, you have an intense period of prevention, and that's where you win the war. If you don't prevent, then you start treating big numbers of people. That is when the PPEs and the ventilators and the wards that we have built come on board. And if you miss those two areas, then you've lost the war completely. If I look at Africa, and I'm lucky that I'm not working for government so I can be independent on this, I can see that our focus when we heard about the virus was on the second stage of this fight. We started getting ready to treat sick people rather than focusing on preventing this disease. And this is what led then to the mass procurement of technologies that we couldn't handle, of ventilators that we can't run, and of quantification of PPEs that will never be enough for so long as we have more people being infected.
Okay.
So we have seen major expenditure, but in the wrong area given the stage where we were in the pre-pandemic.
Okay.
And if we don't go back to prevention and stop counting the beds that we have which are sitting there with nobody on it, then I don't think that we're going to have much effect in reducing the brutality.
Okay.
The third area is being able to link the three core activities on prevention of COVID: masking, distancing, and washing of hands. The cheapest of interventions. We have not done it. Anybody driving from the main road to here, if you met 2 or 3 people with masks, they're probably on their chin. It is not happening in Africa yet. Maybe in Rwanda, but not in the rest of Africa. And if that doesn't happen and we move that to 95%, then there's no amount of ventilators or beds or other technologies that are going to help us.
Okay.
For some reason, we are not too focused on this preventive thing. And we tend to judge ourselves by the number of ICUs that we've built.
And beds.
And beds. My observation is that most beds that have been built for ICUs in Africa have been used 6 months, have not been used 6 months later. Because we also turned the management back to the communities. So home-based care now takes care of 8 out of 10 people with COVID. So we may clothe the nurses and the doctors in all the best PPEs, but who's clothing the community out there that's looking after the 8? Transmission is coming there. Okay. And what is it that we're doing in that? Is there an exemplar in that area for us to be able to do?
Okay. All right.
A final area that I'd like us to put our dots on and exemplars is on the African mentality. And KUSI being a place of ideas, this must be at the center of everything that we do. Number one, how much confidence do we have in ourselves and in our own people and in our own advisors? A lot of our ministries of health, and I'm not mentioning any by name, are still relying on CDC, welcome, and so on. Even when CDC is not trusted by Trump, but we trust them here more than Trump. So how much of that is homegrown? This inferiority complex that if they don't say we are doing it right, then we haven't done it, is a big, big problem for us. And if ideas are to be there, let's put that on the table.
Okay.
2 is the issue linking that to dependence. How much of this money that we are spending on these places is our own money? How much have we turned out of our own budget? Not the World Bank money, not DFID money, our own money, to make sure that we move towards making this. And of course, local innovation. Okay. There is a lot of local innovation, Edmund, but a lot of them don't see the light of day because they quickly submerged by the cheaper ones that come with international NGOs. So a small boy makes something that you could wash your hands on in the village, but next week some international donor comes with plastic bags and plastic cans that have already been made, and that becomes easier to adopt. So exemplars, absolutely. But I think that for us to fight COVID, there has to be an African approach, and I haven't seen it yet.
Right. Thank you so much. Dr. Aman, as a matter of preparedness, Africa resolved to adopt the universal health coverage sometime in 2016 during a conference in Nairobi. Kenya lags behind in that. Rwanda, of course, leading the continent with regard to that. And I think there are some critical conversations going on right now at national government level and, of course, county government level after those deliberations in Mombasa. Where are we with this as Kenya, of course, first of all, and as a continent? And how much would having this in place at the arrival of COVID helped?
Thank you, Edmund. I think you will recall that when we started our journey on UHC, at least in our country here, we decided to do a pilot in 4 counties. We did a pilot in 4 counties, which was based largely on input financing. In other words, trying to be able to put in resources to build and strengthen the health systems. This was an approach that was informed by the fact that our health systems have over the years not been at the level that they're desired to be. Equally, our health approach in the past has been one of focusing upon curative rather than preventive. And UHC does require a very strong foundation in primary health care, in preventive medicine. This has been proven wherever UHC has succeeded. You need to have a very strong primary health care system. Clearly, in places like Rwanda, Ethiopia, they have very strong primary health care systems. So the approach is now moving towards building up our health systems, creating that primary health care foundation and pillar that will be able to drive our universal health coverage. We have an element of insurance involved, which was not involved in the beginning, but the idea really is to move from an input financing type of an arrangement to an output-based financing. In other words, once you have assist systems that are in place, then the system should be able to drive itself, and that people should be able to seek healthcare through an insurance system that will then reimburse those facilities and continue that cycle of investing within the facilities. That is the approach that we are now on. The governors are fully on board on this, And we are moving forward with that. We are going to begin the insurance with identifying those that are really in need, those who are vulnerable, the really poor and indigent within our communities are being identified right now, being registered, and being provided with that cover from NHIF so that they can be able to go and seek some of these services. We have also looked at the panel of services that could be availed in this package. It's quite a comprehensive package that now beneficiaries of the program can go and able to get services for. So we are on that journey. It's going to be a journey, and it's going to require tweaking and changes along the way. But that is the path we are on, is moving finally to an insurance system that will be based on output financing. Thank you.
Okay, thank you so much. Dr. Siobhan, and I know Rwanda, having led in universal health coverage within the continent to a great degree, having implemented that, there's an element of community health volunteers, and they've been very critical during this period in terms of just getting to the remote areas within the regions that they serve in. And Kenya, of course, takes this very seriously, the issue of CHVs, by way of training, by way of remuneration, and being equipped to be able to facilitate some of these functions. How is it in Rwanda, do you think?
So they're about, sorry, they're about 60, every single village has about 3 community health workers, and they're divided into there's a section that deals with children, and then one that deals with adults, and so on. And they've been really, really critical at the best of the care. So the community health workers, they have a small package of conditions that they deal with, and then there's a referral system to the health centers that we work with. And also we have health posts and health centers that they work with. But every single village has community health workers. And then there's a higher package that is given at health centers. So in terms of how we as Babo work with community, we work mainly at health centers, because this is what we need primarily is laboratory and prescriptions which are given at that level. So we do about 3,000 consultations every single day, and we do that. So how we work with community health workers is, because it's a referral system, if somebody has, let's say, a simple headache or something, and maybe a community health worker can give paracetamol, they would refer these people to the digital health system that then work with us.
Okay. Dr. Sabine, we have to talk about this, and this is the issue of herbal and traditional medicines, all right? We had a case in Madagascar, and they even sold it to some other countries, neighboring countries. And the WHO, while acknowledging this, says it's important for us to test the efficacy of some of these things. I don't know whether you've had a similar case in Rwanda and how you're approaching this, because Africans have a traditional way of doing their things, and it works for them. What do you think about this, really?
Thank you. So with COVID, we've seen a lot. I would say we've seen so many ideas. But if you look into the and behind these kind of motivations, there's a lot of things. So we've had also people here in Rwanda saying that with COVID, they can even say some few words and then the virus is out. We've seen traditional healers just proposing some mixture of herbal products and even proposing different type of medicine. As you said, we've seen it in other African countries, but also I believe in other continents. So I'm not saying that local medicine or traditional medicine, as we say, can't help, but sometimes you need to be very careful, and that's why we have these regulatory bodies that are always looking at the basic science, because experience has shown, yes, some may be useful, but not always good. So what we know so far is that COVID has no proven medication that will take this virus out of the body. That is a fact. Even the 4 drugs that have been tried by the World Health Organization did not show any significant difference in terms of this therapy. Okay. But the fact that generally this virus can be eliminated by our own immune system if it is helped. I mean, for majority of cases, for example, here, out of 100 patients that people who are infected by this virus, 70% do not show any symptom, and they actually can clear the virus without even receiving extra type of medication other than just staying home and take some few basic practices like drinking enough and making sure you don't expose others. So it looks like this virus is still challenging us, and no one has a medication right now that is the magic bullet. We expect a lot from these vaccines, but these traditional practices and local ideas that can make the changes applied probably in the preventive parts, in management parts, and probably less on this cure element, which is obviously naturally if some people can. If those can't, again, there is the advanced medicine that can help. Okay. I don't know if I responded to your question properly, but I'm happy to go on again.
It's a difficult one to respond to because obviously of the various ideas that we are looking at here. Dr. Ogo, the issue of vaccines that he brings about, and this is, as we head on to this next phase of managing this disease, this is becoming more and more prominent. There are concerns around storage and distribution, and especially within the continent, being a temperate continent. You're talking about minus 70 degrees, minus 80 degrees for some of the vaccines and candidates that are being talked about. Is Africa ready for this? First of all, distribution and getting it to every single citizen.
Edmund, I want to focus on this area, but I'm a little bit concerned here that, again, we shall be hyping vaccines to a continent that is still struggling and has struggled with getting polio vaccine 50 years later. So there's one thing about the discovery of a vaccine, which is quite different from having a vaccination program put in place. And for Africa, we have to go through both stages. First of all, there's vaccines out there that don't belong to us.
Okay.
How do we get it here? Can we buy it? Most likely we cannot. So who is going to donate it to us? And that should be the big discussion there, the donation of that. Then comes which vaccine, because very soon we'll have multiple. And we know that the 2, Pfizer and the Moderna one, those are the ones that require a lot of freezing. Minus 70 is difficult for Kisumu. Yeah.
For obvious reasons.
For obvious reasons. For AstraZeneca, that one is much more like our normal vaccine. And that's the one that we've also been participating in working on. So if you ask me, I could probably have more hope in the AstraZeneca one coming here and getting us to where we are.
Okay.
But before that, what we must tell our people is that the vaccine is not going to be the magic bullet. Because even with the vaccine, you still have to do the preventive things. Those 3 things. So if we are going to abandon those because it's been a vaccine, that's a big mistake. Secondly, there's still a lot we don't know about these vaccines. They are being approved for emergency use, not for routine use.
Okay.
So the question is, if you get your 2 jabs, how long does it protect you? That's important because we do know that people who've gotten COVID get reinfected. So if it's going to require that every 6 months we do it, then it's not just a question of getting the first batch. It's a question of having the supply chain that makes that thing start moving. Now, when it comes to the cold chain area probably has been one of the most trying areas in vaccine use across the world. And the colder the chain, the more difficult it is. If we are going to move in this area, then I would advise that we quickly look and work outside the box. Because the cold chain must not be seen only from the health standpoint, and let's ask ourselves, what industries in Africa right now survive with some modicum of cold chain? It could be in the food industry, it could be everywhere else. And you may find that there will be big capacities that are underutilized at the moment, whether they were for fish or for something else. And Professor Nyong'o may be happy to start helping us know around the lake here, which are the freezing points for fish and at what temperatures. If they're doing it at -20, could they rapidly move to -50 and -70? What would that mean? Because that would mean then that Kisumu probably may be the center of distribution of this thing if we have -70 capability here. And it is possible. So it's really looking outside the box. But for Africa, I would say that vaccines should be part of the side discussion in 2021. This is not something that's coming over Christmas. It's definitely not coming over Easter. And let us start talking of Jamhuri of next year for us to be able to look at that. Now, 1 year of COVID without vaccine and with no strong prevention is brutal. And that is what we must avoid.
Okay. Dr. Aman, I have to ask you this, because upon the announcement that Pfizer and Moderna had developed some potential candidates, the government of Kenya issued a very strongly worded statement saying that we are still being careful, we are waiting for more tests and all of that. What is the position, and especially based on what he brings about, of being very careful and knowing what works for us?
Thank you, Edmund. I think being careful is really making sure that whatever product that you choose to use or that will be available on the market has gone through the rigorous scientific testing that is required. Therapeutics and vaccines go through very, very rigorous testing regimes to make sure, number one, that they are safe.
Is that okay?
And the early stages of testing focus on safety of the product. Is it safe? Does it have any adverse reactions, serious adverse reactions?
Okay.
Beyond the safety, then you move to the efficacy. Is it effective? Can it do what it is intended to do?
Yeah, okay.
And
because it doesn't take long.
So those are the important things, and there are standard ways of doing it. Most of these vaccines that we are seeing have gone through those stages, of course, at a very accelerated pace. But the data that has been generated tend to show that they have satisfied some of the requirements. Indeed, that is why they are being given emergency use authorization by those regulatory bodies. So in that sense, those products that are now in the front line, I would say, have gone through the processes. In terms of any drug or any vaccine, there are things that you will never know about those vaccines unless they have been used in mass over a period of time. And this is what is called the phase 4 of clinical trials. Because of the large sample size that will be exposed to this, you might then be able to pick up a few reactions, 1 or 2 fairly serious reactions that could really compromise the use of that vaccine. So coming back to your question, I think our position is we will do the right thing in terms of following the science and the knowledge that has been generated and the data that has been generated. We have, in addition to the international bodies that look at this data, we also have our own regulatory body. So we are open to take on any vaccine that we are satisfied will be able to protect our people and not harm them against the disease. We, as Professor Rogo has said, the AstraZeneca vaccine seems to be the one, I think, that seems to be more appropriate for our situations in Africa, because it can be stored in the temperatures that our other primary vaccines are used for. It can use that supply chain. But is that cold chain system good enough? We need to work on that. We need to make sure that that cold chain system is efficient and works. And in terms of accessibility to these vaccines, the two frontline vaccines, the messenger RNA-based vaccines of Pfizer and BioNTech and Moderna, aside from their storage conditions, those have already been taken up. The production of some of these vaccines until 2022 has already been taken up by some of the US, the European Union, and so on.
Okay.
The Moderna, the AstraZeneca vaccine, they have signed up with the Serum Institute of India to be able to produce, and it's very likely that there may be an avenue to acquire these samples through that Serum Institute of India. In terms of availability of vaccines, there is, in fact, a discussion, a global discussion called the COVAX facility discussion, where Gavi and WHO and many other organizations that have been active in facilitating provision of vaccines to developing countries. There are discussions on how that facility can be able to access some of these upcoming vaccines and avail them to developing countries. Thank you.
Very quickly, before we get into the questions, now that we are talking about foreign vaccines and how they may or may not work for us, Africa as well has been participating in this, search for a vaccine, and Kenya and South Africa actually involved. How are we doing with that? Because perhaps that would work for us better in the understanding of, our anatomy and all those other biological things that you mentioned when talking about vaccines.
That is still directed at me?
Yes.
Yes. When we say, we need to be very clear about one thing. Do we as a continent or even as a country have the capacity to be able to develop a vaccine? If you ask me that question, I'll tell you we don't. Because it takes a lot to develop a vaccine from basic principles and take it through to a point where it can be a product. Do we have scientific capacity to be able to participate in the testing of vaccines? Yes, we do. We can test them on our populations, we can do the necessary things that are required in a laboratory, but we don't have the capacity to do that. And the point that I want to stress and make here, because this is a point where we want to share ideas and vision, if we do not invest as a continent in research and development, in technology, whether it is ICT or biotechnology, we will always be end users of products. We will not be innovators and discoverers of products. We need to make that shift deliberately, and we need to resource that ability to be able to become a nation that is able to innovate and produce products.
Okay.
Thank you.
Thank you so much. Dr. Sabin, there's a question here regarding the very issue of vaccines by Frank Owen Wafula, who asks, we are good in investment in technology. Why would we not be quick to further use the information we have been getting in collaboration with already approved vaccine companies and assist local citizens? The vaccines are out. Why would we wait to get them to shield even our own doctors from deaths? We've seen the UK has already taken up the Pfizer and BioNTech vaccine. That's to you, Dr. Sabin. All right, then I think we don't have Dr. Sabin. Let's speak to then Dr. Shivon about this.
Should I go ahead and respond this?
All right. Yes, please. Yes, please. Let's speak to then about. All right. Yes, please.
Okay. Thank you. I think this discussion to me, needs to happen right now, because we are in a junction between an epidemic that we are fighting with traditional ways of social distancing, hand washing, and wearing masks. But we are missing something very, very important, which is the vaccine. And all the pandemics we've seen being controlled is because we had used vaccines. So to me, having this vaccine discussion now it's very, very important. Although there's several questions on the safety given the accelerated development, there's so many questions about many other beliefs, and this is not new. We've seen it on other vaccines in the past. So I believe that there's so many development, there's so many changes that happened with COVID, with this technology, as I mentioned earlier, that we're seeing also on the vaccine development, which is going probably to be replicated on future vaccine development. And I hope also that with this example of developing a vaccine within half a year period, yet we knew that it takes 10 years or more, can be something good for maybe HIV vaccine that has been waited for so long. Techniques to develop future vaccines like hepatitis C vaccine, which we are also. Me, this is a technological advance. It is a mindset change. It is a financial change, also an investment in the health sector, because why this has happened so quickly, it's not because people had a new brain. It's not because people has a new ways of appreciating this danger. It is because people took time to invest the proper resources to make it happen. If you look at how much money has been invested in these 4 vaccines that have reached the it's a lot of money, but worth investing in protecting people. And these 2 vaccines, the vaccine, the Moderna vaccine, used a technology we never seen before, based on messenger RNA. This is something in medicine we didn't know could happen. But it's a quick advance that maybe more new things will happen. Developing a vaccine based on this new technique, of course, very hard to maintain because it's so unstable. Requires a very strong, a very cold chain system. But to me, we should not be worried about the conservation and the transport for this vaccine. We should see how we can get it as quick as possible to protect those who are vulnerable, if we are comfortable with the science behind.
All right. Thank you so much, Dr. Sabine. And this next question is from Michael Kilonzo, and I will direct it to Dr. Shivon because of the tech angle. How inclusive are governments as per persons with disability, I believe is what you want to ask. And I want to tweak it, Dr. Shivon, to you. By way of the technology that you have developed, how are people living with disabilities accommodated in this? Especially with regard to COVID-19 and communication.
So our product is very inclusive. If anyone has a mobile phone with whatever disability, if anyone has a mobile phone and can speak in what we
Okay.
If you
apologies because of some of the technical challenges. Those joining us or participating virtually, we seem to be having some interruptions, but we are fixing those as we work on that with Dr. Shivon. Dr. Rogo, there's a question here on. Yes, I agree, and this is from Michael Simiu. I agree that Africa put in place various measures to respond to the pandemic, which is still ongoing, as you said. However, there were suggestions from researchers that the non-apocalyptic effect of the virus was largely due to Africa's young population and climatic conditions. Therefore, my question is, can we say Africa is ready to handle pandemics in future, just in case we will not be favored by climatic conditions and age of the population?
No, we are not. It's an enigma that the parts of the world that are prone to emergencies tend to be the ones that are least prepared to manage emergencies. And that lack of preparation is not just monetary, it's in systems. To fight COVID, What you need is to have a system that works for everybody. Everybody, because the virus attacks everybody. And we've had problems in creating systems that work with everybody. That's why the UHC mantra was supposed to be universal, and it isn't happening. Remember, the developed world thought by the time COVID arrived that they were in post-infectious disease era. They are now dealing with non-communicable diseases. So this thing has come to them as a surprise. But for us, it didn't come to us as a surprise. We are in that era, and yet we were unable to mobilize to prevent it. We were lucky because we had 6 to 9 months of warning from China to US and everywhere. And we could have contained this thing by not letting it reach the communities. But instead we were buying ventilators, which don't prevent COVID. So now this thing is in the community. The question here is, will ventilators help you? It won't.
Yes.
And if we are going to move in this area, we have to really think differently. Let me give you an example on that. Suppose we had 1 million vials of one of these vaccines landing in Africa today. Who will get it first? I'm not saying who should. Who will get it first? Will it be the president and his cabinet? Will it be parliamentarians? Will it be doctors and nurses? Will it be community health workers who are taking care of 8 of 10 COVID patients right now in the villages? If you have an answer to that, then you know what we need to deal with.
Okay. All right. This is to you, Dr. Aman. Easter Achieng Okech. Looking forward to concrete ideas on how to manage primary healthcare as an element of UHC and ensure that infection prevention, particularly among health workers, is holistically addressed. This shall ensure that the health systems can respond holistically to communities through a robust community strategy that shall ensure information is shared within households. And her question, therefore, is this. How do we ensure that we address these issues holistically through ensuring the 7 building blocks of healthcare are invested in and that we protect the critical resources meant for quality healthcare?
Thank you, Edmund. I think I have said over and over again that any health system needs to be strong enough then to be able to operate on whatever other programs that you want to do. Take, for example, universal health coverage. Universal health coverage needs a foundation of very strong health systems. There are 7 WHO building blocks that have been identified, include a number of things, including HRH, health products and technologies, and so on. I think that is an area that we as a country here have had a lot of deficiencies and gaps in those blocks. To date, we don't have enough HRH to be able to meet the recommended ratios that are required. So building that health system is extremely important. Even on an insurance-based universal health coverage program, it has to be founded upon a strong health system. So as we go along this journey of policy, we need to be able to build those health systems so that they can buttress the program that we are implementing. Clearly, we have a strategy, we have a community health strategy, we have a primary healthcare strategy. We need to implement them, and we are in the process now of implementing that primary healthcare strategy of strengthening those level 1 and 2 and the community level healthcare services that are available at those levels. It's not an easy task, it's a monumental task, but it has been done elsewhere. You heard Rwanda, Ethiopia have very strong community health systems. We are moving towards building that community health basis. We are promoting the idea of having family medicine doctors who would be able to operate at that level, at the level 1s, level 2s and 3s and level 1, interfacing with the community, together with this corps of army of community health workers. So those plans are in work. They are part of the strategy, and they will be implemented as we move on this UHC journey.
All right.
Thank you.
Thank you so much. That has been our first session on the African exemplars, how to the African resilience and smarts that were revealed during this period of the pandemic. And we've had with us the Honorable Dr. Rashid Aman, who is the Chief Administrative Secretary in the Ministry of Health, Kenya. Dr. Sabine Nsanzimana from Rwanda has been speaking to us live from there. He's the Director General of Rwanda Biomedical Center, the operational arm of the Ministry of Health in Rwanda. And Dr. Kamarogo, who is the founder of the African Institute for Health Transformation. And finally, Dr. Shivon Biamukama, also from Rwanda, joining us and participating virtually. She is the Managing Director of Bebil Rwanda, a digital health care provider. Thank you so much to our panelists. A round of applause, please. Asante sana. I see we've forgotten that we are supposed to do it in an orderly way, yeah? Which is basically just 3 claps. All right? So 1, 2, 3. Thank you very much. Thank you very much to our panelists. As we build on to the next session, at this moment in time, yes, please just take your seats. Okay. Thank you very much. Let's take a quick break on this program today. We'll be back shortly. Stay with us.
This is NTV.
Hi, I am Eliud Kipchoge, World Marathon record holder. I am here to encourage you to be active, to keep moving, and be positive in life.
Remember to continue using your Hafsa debit or credit card when out shopping to win fantastic rewards.
That's African acid. That's absent.
From far with you. I even gifted you a magnificent house. Rosa, it's the thought that counts. Please help me.
When it comes to fever, you need to be both. Panadol Baby and Infant starts to work on fever in 15 minutes and is gentle on the tummy. Panadol Baby and Infant, tough on fever, gentle on your child.
Go Ahead is believing to make each day a brighter day. The confidence to create opportunity. Going ahead is our courage to do something new. To go ahead. Now, that is the Kenyan spirit.
To achieve great things in life, you must do little things every day, like the 1, 2, 3 with Colgate.
1, wake up, wake up. 2, brush up, brush up. 3, smile through your day with a fresh breath and strong tea. Smile through your day with a fresh breath and strong tea.
Do the 1, 2, 3 with Colgate and give yourself a future to smile about.
Sharia-compliant banking in Kenya. Is the regulatory environment adequately suited for Islamic banking? Is the market ready for uptake of products such as sukuks? How does Islamic banking deal with risk pricing in an environment of deteriorated asset quality? In the next edition of Business Redefined, we speak to the head of Islamic banking at KCB Group for this and more.
I think that deep down she wants to be your friend, but she doesn't know how to get close to you.
I just don't feel good about her wanting to get close to Bobby.
They brought my husband back in a box turned to ashes. Do you know how painful that is for me?
Why are you so desperate for that Martha? You even want to beg for her forgiveness.
Well, that's over. I know that you have a thing for Luciana. That is why you want to get rid of me. Don't be absurd, Miguel. Tell me, why are you acting like this? That's because you placed my vineyard and everybody's job at risk. I only did that to help that poor woman. Why can't you understand that? That all you had to do was to let me know, Miguel.
Every spoonful of Nutri comes loaded with the necessary vitamins, protein and minerals for you and your family to become healthier and stronger. Pick up a pack today from your nearest store. Nutri, every spoonful counts.
Violence against women is the most pervasive breach of human rights worldwide. At the inaugural Women's Global Leadership Institute in 1991, activists introduced the annual 16 Days of Activism Against Gender-Based Violence to call for the prevention and elimination of violence against women and girls. The campaign takes place between 25th November and 10th December. On Wednesday, 9th December 2020, NTV, in partnership with UN Women, will hold a virtual live panel discussion on the prevalence of gender-based violence in Kenya and around the world. It will delve into the root causes of violence, access to justice for victims, and the available funding opportunities for survivors of gender-based violence in an effort to explore possible prevention measures during and after the COVID-19 pandemic. Join the virtual conversation live on NTV Wednesday from 8 p.m.
Unashtakiwa na kitu hata hiyo public nuisance, mimi siko najua hiyo ni nini. Then the next nikaambiwa murder ya msaidizi wangu Rastamende. Hiyo crime mimi nilisomea yangu nikakubali.
Niliingia nikiwa mchanga sana committee.
And when the gates open, you're so excited to start life again.
I don't have the identity card. I'm like a luggage to my mom.
Kutoka nikapata mtoto wangu mmoja ameteseka.
Find such an unforgiving society that brands you an ex-con.
I've had many opportunities to get better jobs. Then that's when I went to the DCI. Nikawambia, then wakaniambia they can't, I wasn't saying.
Can something be done? Because actually it really denies many inmates an opportunity to progress.
Maxi!
Pinky?
No, na siku hizi umeamua kudowngrade. I'm sorry, who are you? I'm his girlfriend.
Hey!
Rhyme, umesikia? Mimi nafanya hizi vitu zote kwa sababu nakupenda.
Good morning. In the afternoon.
Hizo pombe zako umekunywa, eh?
Kuna pombe yako nimekunywa. Listen to me carefully. Wachana na sera.
What a relief! Thank you, Gold Crown.
If regular milk makes you feel uncomfortable, try Gold Crown lactose-free milk. Milk that loves you.
I'm waking you up to the hottest morning show. Tina Kagia, the morning fix. Nation FM.
Hey, how are you doing? I am Tina Kagia, aka The Voice. And every single morning, starting from 6 up until 10, catch me on the Morning Fix on 96.3 Nation FM, where good music lives. Let's have awesome conversations. Talk about life, love, money, politics, school, education. No topic is out of bounds.
Mornings with Tina Kagia, 96.3.
Nothing but the best of conversations. Talk about your stories, because honestly, it's important to unwind. See you every day.
All the hits with Tina Kagia.
They're my morning show.
The Morning Fix on Nation FM.
Nation FM.
Where good music lives.
Do you want a good life? Declare Psalm 23 verse 6. Surely your goodness and love will follow me all the days of my life, and I will dwell in the house of the Lord forever. It shall be so, and it cannot be otherwise.
To get Goodness and Love by Vuma, dial star 811 star 923 hash. Skiza, Non-Nation.
We are Nation, Africa's independent media brand. We are committed to empowering all Africans, from the young to the old, from the curious to the educated, and from the heart of the cities to the rural areas. We are Nation. Join us, because if you want to get far, you do it together. Nation. Empower Africa.
Everybody!
On Unscripted with Grace.
Discussing a skin condition which I think and feel has not been given adequate awareness.
I first got vitiligo when I was 14 years.
The 3 spots joined into one.
Yeah.
And then it continues spreading. Yeah. Beauty is art. And it's not art as per the world standard,
yes,
but as per God's standard.
Yes. The person I was dating told me, you know what, I'm actually doing you a favor. I felt if he ever left, who will come and date me?
So you have to constantly just talk to yourself, have a little self-talk before you get out of the house.
Only on NTV.
What a relief! Thank you, Gold Crown. If regular milk makes you feel uncomfortable, try Gold Crown lactose-free milk. Milk that loves you.
Finding meaningful stories takes more drive and passion.
Father's involvement in maternal and reproductive health is slowly becoming a game changer.
Getting to the truth takes more determination.
Hakuna. Nilikuwa kilio changu ni watoto wanapata shida chakula, lakini nimeona Kenya yetu watu wamenishika mkono.
Finding real solutions takes more understanding.
Shortage of teachers, lack of textbooks.
Afadhali mtoto awe chini ya miti badala ya awe na chupa ya glue kwa mapua.
And NTV investigates leads to impact.
This building here has got its fair share of criminals.
Who are these COVID billionaires?
Corruption related to PPE, it's actually a murder.
So these are patients with cerebral palsy.
From what I saw being aired in NTV, it really broke my heart.
NTV, stories that impact you.
Welcome to Pishi Home Chef.
Oh,
just perfect.
We're gonna be cooking breakfast.
Making chicken shikaki, carbonara.
And I'm so happy to be on this show.
Most people think I can't cook the garden. I forgot onions.
So I have to call her literally to call her and ask her and say your recipe.
Pishi Yoi.
Check out at Pishi254.
It's one platform where everybody has a voice.
If we don't have jobs, if we don't have money, if we're not, if our business...
Hosted by the King of Wit.
Do you know the Bible to that much detail? Ama hizi ni zile tu zinaendanishana na dhambi zenye unajua.
It's basically everybody's show.
Vitamin C ni cassava, shauri ya nguvu. Vitamin D ni dania. I have decided.
The Wicked Edition with Dr. King Ori and the Guesswork CEO, Kinya Jui.
The Kisumu County Assembly specializes in stimulants, to be specific, concentrated coffee.
Where humor meets sense.
Moses Kuri alinitwanga hapa serious.
Soldiers wanakuanga wameka polisi kids. Mbona nyinyi mkimbiangi mkituona?
The Wicked Edition. Every Friday at 7:30 p.m. only on NTV. NTV, turning on your world. The following program has been rated PG. It may contain scenes unsuitable for children under the age of 10.